Hello, my name is Dr. Mazansky, and before we begin, I'd like to make an announcement. I have a new website, drmedicalhypnosis.com, drmedicalhypnosis.com, upon which there are 25 different health hypnosis videos. I've received many requests to do this, and after much time and tribulation and hard work, it is finally in production. There are many either for videos for yourself or your loved one, but for the ultimate and total relaxation, check out the brain and body massage hypnosis video. That is really extremely relaxing for many of us who come home after a hard day's work or have had a hard day with the kids. This, I promise you, is the ultimate. So it's DR for drmedicalhypnosis.com. Let's begin today with a health tip. The title of today's tip is Good versus Bad Cholesterol. The word cholesterol in America conjures up many things, and everybody's worried about their cholesterol level, and so some should be, because high cholesterol, which is a blood fat, and high triglycerides, which is a different type of fat, can lead to blockage of the arteries in the heart attack, brain, stroke, legs, PAD, peripheral artery disease. The cholesterol stops up and blocks the arteries, leading to blood supply decrease to that area of the body. Now, there are two types of cholesterol, the good and bad cholesterol. Good cholesterol is called HDL, or high density lipoproteins, and the bad cholesterol is called LDL, which is low density lipoproteins. There was a time when the medical profession was always concerned about the HDL being raised, the good cholesterol. Through years of medical research, we've now found that the important one is the LDL. The LDL should be below 100. Higher than 140 can cause damage. And the LDL particles that come from the belly fat and from food. Today we are more concerned about LDL. The HDL, or high density lipoproteins, being the good protective type of cholesterol, should be at least 60 or above. Now, if these types of cholesterols, if they're abnormal, one always tries firstly to use a comprehensive nutrition program and an exercise program to alter them. But if after some time the patients have been adherent and it doesn't alter, then they are put on drugs. And the most common drug that is used today is called the statin drugs. There is another blood fat that is gaining ground in importance called triglycerides. That too comes from your belly fat and particles in food. And high triglycerides are raised by alcohol intake. And in diabetics, high cholesterol and high triglycerides, their triglyceride level can be very high. Triglycerides are raised by white flour, unrefined flour, and the so-called junk food. That raises the triglycerides. We don't need to use medication to lower the triglycerides unless they are extremely high. But a nutritious eating program together with exercise will reduce that. Taking too much alcohol increases your triglyceride level, which, as I say, can affect the heart and the brain eventually. The whole thing is to be judicious about eating correctly and exercising. There is a familial type of increased cholesterol called familial hypercholesterolemia, and in these cases, the cholesterol can go as high as 300 or 400 milligrams per deciliter. These patients definitely need high doses of statins and other cholesterol-lowering drugs. An underactive thyroid called hypothyroidism is associated with an elevation in the cholesterol and triglycerides. So if you do have high cholesterol and triglycerides, make sure to ask your physician, if they haven't done it already, to do a thyroid check, because that is the reason for your abnormal cholesterol, is hypo or underactive thyroid. The best thing to keep these blood fats low: exercise, eat plenty of fruits and vegetables, lean meat, chicken and turkey, exercise as much as you can, and maintain general health, and your good and bad cholesterol, one will remain high, the good, and the bad will remain low. My name is Dr. Hillel Mazansky, and I thank you for listening to this health tip.